And tonight, getting help for thousands of U.S. soldiers who are committing desperate acts while deployed and for those who've returned home.
Indiana Senator Joe Donnelly hopes to stop the rising number of military suicides by making annual mental health evaluations mandatory. Our TV6 reporter Chris Prophet is live outside our Monument Circle studios. Chris.
And Erica, this card is given to military personnel when they're deployed and also when they come home. It's from the Department of Defense and the U.S. Department of Veteran Affairs, and it's to recognize the signs of suicide risk. But this proposed legislation goes much further in requiring yearly mental health evaluations. Army Specialist Chancellor Kiesling was only 25 and on his second tour of duty when he shot and killed himself in Iraq in 2009. 21-year-old Specialist Jacob Sexton shot and killed himself at a Muncie movie theater also in 2009 while on leave from serving in Afghanistan. Both men are part of an alarming trend of military suicides. In 2012, 297 Americans were killed in combat, while 522 committed suicide. In 2013, 118 died in combat, while 470 killed themselves.
So my son was under suicide watch his first deployment in 07, and the decision was made not to report it, to hide it, to help further his career. And so when he got in trouble his second deployment, his commanders didn't know. Nobody knew.
Because of the rising number of military suicides, Indiana Senator Joe Donnelly authored the Jacob Sexton Act that would require annual comprehensive mental health screenings for all active duty National Guard and Reserve personnel.
When they come back home with the challenges they faced, that they have someone to talk to and to help change their lives.
The legislation would also make the results of mental health evaluations private so that it can't affect military promotions.
It will save families, wives, children, mothers from all the pain I've had to go through and I will always have to go through.
With more service members returning from active duty, the concern is that the need for mental health services will only escalate over the next 5 to 10 years. Counseling and treatment needed to prevent desperate acts committed by heroic men and women. And the cost of the assessments per year estimated around $10 million. However, proponents of this legislation say that's nothing compared to the number of men and women who are killing themselves while on duty and after they come home. Reporting live downtown, Chris Prophet, RTV6.